My name is Dr. Hunter Waddell. I'm an orthopedic spine surgeon at the Spine Center of Louisiana. I'm originally from Shreveport. My dad was also an orthopedic surgeon, but I grew up on a cattle farm there. My medical journey of training kind of took me all across the country. I started out in undergrad going to the University of Arkansas on a baseball scholarship, and then from there came back to Louisiana where I got my medical degree at LSU in New Orleans. I then matched into my orthopedic residency at Vanderbilt, and then I kind of rounded out my 10 years of medical training at the top spine fellowship in the country at Rothman Orthopedic Institute in Philadelphia. I'm seeing patients in Livingston Parish, but also in Lafayette, Louisiana, and I'm going to be performing surgery in Hammond, Louisiana, as well as in Baton Rouge. So I chose orthopedics because I love the biomechanics of the musculoskeletal system. I remember being a resident at Vanderbilt and going through my spine rotation for the first time, and my wife, kind of behind my back, would tell people without me knowing, like, Hunter's going to end up doing spine because he's so energized, he's so excited when he comes home from work every day despite the long hours. That was kind of the first realization moment for me when I just saw how happy I was, taking care of these patients that have spine problems. There's that immediate gratification of them feeling better after the surgery and then getting back to what they want to do after is really rewarding. I really want to just take the culmination of my 10 years of medical training that has kind of taken me all across the country and give back to patients that are right here in my home state, which I take a lot of pride in being able to do. And I want to give just a patient-centered approach that is going to be as personalized and as individualized as it really can be for them. I want them to feel listened to and special when they leave my office, whether they have an operative or a non-operative problem. That's ultimately what we want to do at the Spine Center of Louisiana, is we want to have a patient-centered approach so that we can find out what is going on and what is causing your symptoms. I want to find out where exactly that problem may be so that I can address it in the most minimally invasive way that I can. And I look forward to doing that for the people in Louisiana.